Today we're talking about depression. Super upbeat topic. I know I'm sure you're pumped if you're here. You're like, I'm in a great mood. I need to learn about depression. Um, no, but seriously, like I think there is like having been depressed myself and not knowing it. Like I think there's such a I don't know stigma. You don't know what it is, what it feels like, all this stuff, and so that's why I thought it'd be a great conversation. Definitely for probably the people that are closer to a crisis than maybe just the regular quarter lifer who's like, everything's all right. Um, but today's guest is Annie. She is a primary care physician. She's one of my friends. She definitely brings a unique spin to this topic because she's dealt with depression herself in the past, but she's also a primary care physician for her job. So I'm calling it an expert episode, but we do get into her story in dealing with depression, but obviously she treats this as well. And so is very educated on the topic. So we get into what depression even is, and kind of what it felt like both for Annie and I, the differences between just being sad versus being depressed, the symptoms of depression, and how you can kind of do that self-check yourself to figure out, am I depressed? The differences and similarities of depression and anxiety, the shame around depression, and then we end with ways to treat depression. And at the very, very end, we forgot to talk about the medication side of how do we treat depression. And so Annie took a video herself that we just tacked on to the end. So yeah, it's a good one. It's a serious topic, but hopefully we shed some light on it for you guys and hope you enjoy it. About 21% of adults aged 18 to 29 report experiencing some level of depression symptoms in a 2-week period. And that compared to 16.8% of people in the 30 to 44 bracket. And so you hear 21%, it's like, all right, that's not that much, but it's really 1 in 5 people. And just another stat going off of depression, more related to us, the quarter lifers. And I've said this one before in the identity episode, but about 75% of 25 to 33-year-olds report going through a quarter life crisis characterized by feelings of insecurity, disillusionment, loneliness, and identity confusion. So we're obviously talking about depression today. We've got Annie here to join us to tell us her story, and also just her experience with depression and all that she knows about it professionally. But yeah, I mean, I've dealt with my depression. Sometimes I still feel like I have those day-to-day depression symptoms, and it's definitely a serious topic that I'm excited to go into today. So, Annie, before we talk about your story and your experience with depression, can you tell us a little bit about what you do for work?
Yeah, so I am a primary care physician, board certified family medicine doctor. Part of family medicine in my training is that I take care of the whole picture of the patient. So I see newborns, I can see all the way to hospice through the transition of life, or death. So I see the whole patient, and so not only do I care about what's happening in their body, how their heart and their lungs are working, I also care about how their brain is connecting to their body, and then how the environment impacts their body, and their health and their wellness. So I talk to people about their moods 15 times a day. I listen to their story and I help them process what's going on, how their health impacts their mood and how their mood impacts their health. And then I help kind of come up with what the next step is and how we can, do we need to fix their health, or do we need to, or their physical body, or do we need to help their mood, and like what steps, what medicines, what tools, techniques do we have to help them get better. So I definitely relate to this whole quarter life crisis clarity, how important this transition is. Family medicine provides me this really cool opportunity to work with that, like when you stop seeing the pediatrician and when you start seeing your adult doctor, which big plug for like get an adult doctor, because it's such an important transition of like life and becoming an adult and understanding like why I do the things I do, what things do I want to do. And I see a lot of people who go through depression with this. So it's a really cool field to be in. It's really cool that my day to day, I just get to talk to people about their lives and hear and help them feel better. But I also use my history, my feelings. Like I know what depression feels like in my body. So when people start talking about what they feel in their body, I'm often like, so I hate to break it to you, you're depressed. Like, let's address that and let's go on from there.
Awesome. So are you the person that if I go to have my yearly physical, are you like the last person, the main person that I see?
Yep. I'm the MD that comes in at the end. You've answered the questions 15 times with all the other people, but I look at your blood pressure, I look at your family history, and how all of those things impact your health. But then we also talk about real life stuff.
Awesome. Cool. So I do want to talk about your story of, and we'll get into more of like that side of you, like the expert side of you that knows a lot about depression. But yeah, can you tell me a little bit about going back a little bit to when you've experienced depression, like kind of your story too?
Totally. So I grew up in Texas. I was the youngest of 3 girls, so was constantly looking up to my big sisters, constantly like, what did they do? Let me assess, let me analyze it. How did that make the room feel? Like constantly kind of seeing how they impacted the world around them, and then like deciding exactly what I was going to do based off of that. I also was a dancer, so many hours spent like in the rehearsal space, on the dance team. Middle school girls are terrible human beings. And so you apply that to like your identity of being a dancer and how your body looks and are you cool enough to be in that crew? It just creates this whole madness of what is high school dance teams. And so through all of that, you're like trying to figure out who you are, what you are. And I always was a nerd. Like I would rather be in the science class than the English class or whatever it is. So when I was, graduated high school, figuring out what you want to do, I went to college and was a dance major. So I got to like focus on this thing I really love, which is dance, and knowing more about it and the technique and the artistry behind it. And I made costumes for my job in college and like awesome like artistic things. But then my focus was dance science. So I was in anatomy class. I was in biochemistry, all of those kind of really nerdy side of things. And then was able to kind of link them both together, which was a huge God thing. Yes.
Sorry. Dance science, was that one thing or 2 things?
One thing.
Oh, man.
So yeah, awesome degree. Like huge shout out to my professors who like created this. Yeah. And it was a huge God thing. Like, he created this for me. I was like, I am going to go save the world of dance with my medicine, and it's going to be beautiful. God has put me in this one place to do this one thing, which I still believe. Like, it's still absolutely true. But like in my technique classes, I could be like, oh, this muscle that I just learned about in anatomy, I'm going to use it to engage so that I can get a better turnout so that my leg can get higher in my dance. So it was a really cool kind of like back and forth using both sides of my brain in a really interesting way that I loved. Yeah. So I dove so straight into dance, science, my school, all of that, being in rehearsals, making costumes. I met Adam, my now husband, and so we were spending lots of time together, doing everything together, and lots of other things just kind of fell off. I had a group of friends freshman year, and then girls are mean. And so I was just like, I don't want to deal with that. Like, I'm just not going to have other friends. And then I started kind of pulling away from different things. My family was farther away than I thought they would be. So it was harder to like get home or them come visit me or stuff like that. And I started breaking out and like eczema and all these weird like skin changes. And then I just kind of stopped eating. Like I didn't have any interest in food anymore. That was just didn't really want to.
And that was when in college was that?
My like senior year-ish, because I think, I started college with this whole like, God put me in this one designated time and place to be the medical savior of the dance world. And was so like in that.
Yeah.
And so then you get to your senior year and you're like, okay, but what does that mean?
Now what?
Right. Like, I didn't quite have the best, I took the MCAT, didn't quite have the best MCAT score, so it wasn't like slam dunk of going to med school. Okay. So do I want to go dance professionally? Am I good enough for that? I don't think so. Do I want to teach? That sounds terrible. Like that, like, what do I do with this now? That I had so much, I don't know, it was just a weird feeling of like insecurity and not wanting to do anything.
Yeah, I think a lot of people go through that. And you were feeling that like right towards the end of your senior year.
Yeah. Definitely that like spring semester of senior year. I didn't have much weight to lose, but I lost what I could. I didn't really do things outside of places I had to be. Yeah. And you're laying that with like, this is the time where, if you want to go to medical school, you gotta get in the clinics. You gotta do all this extra work. Why didn't you have research? Why didn't you do all of these things when you were in school? And so it's just such a like dark feeling.
Sounds like despair.
Yeah.
Yeah, like there is no option, especially going back to when you entered college, right? That felt so good. This feels so right. This is exactly where I need to be. And then you get to that next chapter where it's like, well, that kind of feels like it's fallen on its face a little bit. Mm-hmm. And now, none of these options give me that same excitement, that same feeling. And you're kind of just like, I don't want to do any of it, right?
Absolutely. And my Adam joined the Navy. At some point he decided he wanted to be in the Navy and I couldn't say no. Like you can't do that. Yeah. So he joined the Navy and so started like moving really far away and going to, schooling and trainings that he couldn't be in communication with me for weeks at a time. And so what am I living for? What is this? I would find joy in little things, still taught dance here and there. And it took me like way too long to actually sit down and write a medical school application. Like my sister was like, do you want to do this or do you like not? I was like, I guess I do. Yeah. Might as well. Yeah. Do it.
And so this is like right after undergrad?
This gap year.
Okay. Yep.
Yep. Good old gap year. Yep. Highly recommend it because it takes a lot of time to figure things out. Like always take your time. So I went ahead, applied for medical school, got into the one kind of on the island in Texas, in Galveston. So it was a great school. Highly recommend it. But so then you're like, okay, back on track, back on, gonna go save the dance world, basically. Gonna get my medical training and then go save the dance world. But then we got married and Adam deployed underwater. And so so we have that part of my life that's just kind of like on hold. You don't have that person to rely on anymore. You don't have that like good community person who really knows you well. And then school is hard, which is like, med school's hard. Didn't you know what you were getting yourself into? But school is hard and there's just like it's very hard to find joy. Like I'm a find joy kind of person and it just keeps getting harder. And I really stopped eating. I don't eat anymore. Sleep is hard. Energy's down. All of these things. I remember going to a couple of doctor's appointment, had some weird ear things happening that, again, someone handed me the PHQ-9, which we'll talk about, And like as I'm answering it, I'm like, oh, oh yeah, oh, oh that one, oh that one too, oh, and then like I remember the guy like coming in saying like, so about this, and I just like break down in tears. It's that overwhelming like cry. Couldn't do anything else but cry. And he was like, well, let's talk about your ear first, but like let's keep talking about this.
So that PHQ-9 is, can you just, we'll talk about it, but what is that?
Yeah, so it's a patient health questionnaire. It's basically how we've decided to diagnose depression. It asks about the symptoms of depression, and like it's a patient survey. So it's about like what you feel in your own body. And so we can get a gauge on how much is this impacting you. Like, is this just something that you feel like mentioning offhanded to the doctor? Is this like something really changing your life?
So also, just to go back to your story before we really dive into the more technical things, like it sounds like there were two separate stints of depression almost. That one that just led up to that questionnaire where it was like, all right, well, this is really me. I mean, can you shed a little bit more light on just how that felt for you? Just like in the day-to-day. I mean, you talk about not eating, that despair, just hopelessness, I'm sure.
Yeah.
You can take a minute to answer that. If you even want to.
No, it's because it's again like stepping back. And I've like been trying to think about it. She asked me that the other, like, make sure I kind of, what was my answer going to be? Because it's not this black curtain on your face. Like, it's not this, when I talk about mood a lot, I'll bring up the Inside Out reference of like the Disney Pixar movie, because I think it's actually like it's very good. Where like joy is taking over your computer thing, but then sometimes sadness takes over your computer thing. And like the whole lighting design is blue and dark. And like yes, but also no. Like I still felt like myself. I still liked watching the same TV shows that I always watched. You know, I would still go out of my way to hang out with certain groups of people or whatever it is, but it was the like in between times, or like where you look back and you're like, what did I do the last 5 nights? I rotted in my bed. And you're like, oh, big picture, lots of things were still there. I still applied for medical school. I still went to work every day. I, checked things off. I was at Christmas. I was at, like, all of those things. I made stuff, whatever it was. But it was like the in-between space was all darker than, and it was just like that in-between darkness kind of starts building up where you don't really notice it yet. I would think that's kind of what I felt like.
Yeah, I'm trying to think about kind of how I felt. You know, when I talked about in episode 1, I was definitely depressed. I didn't know it. I didn't know I was depressed, but I was just like, I was sad, that's for sure. But yeah, I mean, I think I always kind of go back to despair, which is basically hopelessness. Like, what am I living for? Like, what's the point, kind of? And not that, like, I never had, suicidal thoughts or anything like that, but it was still just, I do these things every day. I show up to work and try to work. And then I lift and I eat and I watch TV and I go to bed and then I do it tomorrow and I do it the next day and then I drink on the weekend. And it's just like, it was a lot of what's the point. And for me, it was definitely, my belief system was completely destroyed. I didn't know what to believe. I didn't know what was true or not. All the decisions, everything that led me to that point was just, I don't know, it just didn't make sense. Everything from my past didn't check out to where I found myself. And it was like, well, if all that stuff that I thought was right, I thought I was doing the right things, but I was really living on autopilot, and all this stuff led me here. So, what do I do now so that in the future I don't kind of make the same mistake again? So I think there's a lot in there to it, but just like, yeah, what do I do about it? I think like that despair.
Yeah,
Uh,
I will say that
mhm.
cognitive dissonance of like, you know, your brain has been trained to believe one thing. You know, our parents raised us to be kind, to be smart, to be our coaches, our directors. They said, work hard and X, Y, and Z will come. You'll win the game, you'll get the award. School, study, you get better grades. It's X and then Y. And then you get to a point to where it doesn't always translate. The equal sign with the cross there, right?
Yeah.
X does not equal Y anymore. Those things, like, life doesn't work as beautifully as the education and the sports ways that they trained us growing up. That's not how real life is. So that dissonance of like, I thought it was always going to be this way and you're telling me it's not, hurts. It hurts our soul. It hurts our um, our output, whether it's how we treat people or how we our actions or our thoughts or those things, like that belief shattering
Mm.
sucks. And that we all feel it in this quarter life transition when you're going out of being a child to an adult. Like,
Yeah.
it can hurt really bad. um
And it hurts really bad, but yeah, I mean, now having gone through it, I say it's the best thing that ever happened to me. And
because
it,
those truths are still there. X does not always equal Y, so it's just kind of reframing the formula.
yeah, I think it's so hard. It's just like doing anytime you're going through a tough time, a tough season. Yeah, it's like this sucks. What's the point? God, what are you doing? Like you're wrong. Like this doesn't check out. And then time passes and you keep showing up. You just things, doors open, doors close, just I don't know. It's interesting how it works out, but yeah, if that's any encouragement for anyone that's kind of going through that either identity crisis right now or just a depression, probably some of both potentially, then yeah, it's hopefully encouraging. And this whole conversation is of just like that refinement of who you are and what you believe and your identity. It's hard, but it's like a snake shedding its skin or something. Like it's hard, but it's so important, and you come out on the other side of that a new person and just closer to that next version of you, which is I don't know. To me, it's like it's an important goal of life.
Yeah, I definitely, and we'll talk more about the data behind like cognitive behavioral therapy as like a treatment for depression. But I also believe that's what God does with us daily and
Mm.
uses the Holy Spirit. So there's space, and as a medical professional, I'm not bringing God into the exam room too often.
Mm.
Like, how I treat patients is definitely something I do, but um, it's interesting how similar, God and the Holy Spirit redefining you and changing you from the inside out. And like that's talked about in the Bible so often. And I think we've all felt it, and like the work that he does to make us more like Jesus. And then cognitive behavioral therapy and how we can change our thoughts and our actions over and over, like, and how those work together. Like, it's the same thing.
Mm.
It's just kind of who's the master
Right.
of it. Not even. It's
Yeah.
it's just the how God has. It's the same thing. It's like how God has designed our
Yeah.
brains.
Yeah, that's what I was gonna say. Is like it's like he knew what he was doing
Yeah.
when he made us this way.
Exactly.
And yeah, I think the just on that too, I've seen more and more lately of just for a while it was science versus God, and the more data or whatever information that comes out, you see that there's more proof that both coexist. which is pretty cool.
I mean, he designed it.
Yeah, right. Yeah.
It's the coolest thing.
Yeah. And so, can you shed some light on what even is depression? Like I said, when I was depressed, I think, um, my dad asked me, "Hey, like, are you depressed?" And I was like, "I don't know, dude. Probably." Like, I had no freaking clue. Like I said, I was just sad, despair, hopelessness, just sad. So, what would you say even is depression?
Mm-hmm. So the world, I'm going to step back and get a little technical and nerdy. The world of psychology is weird because we have identified a lot of illness patterns, so ways that people fall into the same pattern of getting sick or of so depression is an illness pattern. We see this pattern of people, and so let's just kind of group it together is what we do in psychology. Whereas other parts of medicine, I can order a blood test and I can see that the number isn't what is normal, and so that's why something is wrong. This one, we just kind of have to talk to you and see if we feel like you're vibing in this illness pattern. So how we define those illness patterns is what we call the DSM-5. So it's the big smart people of psychology wrote out some lists for us to put them all together. So for depression, we specifically say you have to have a depressed mood, you have to feel sad, and then just like decreased interest. Those are the two big things. So depressed, feeling sad, and just not wanting to do, not just like feeling less interested in things that you typically would find joy. It has to be at least 2 weeks, and no other medical things that contribute to feeling sad. There are vitamin deficiencies, there are thyroid diseases, things like that give you a depressed mood or a decreased interest. Again, get a primary care doctor, get some blood work done. All highly recommend it. But we have to have those two things for 2 weeks, and it has to cause some impairment in your functioning. So it's not just like I feel sad, but everything else about my life is happy dandy, fine, whatever. Like that's feeling sad. Yeah. That's having an emotion. That's being human. You are allowed to feel sad, especially in times of grief, times of change. That is okay. It's when that darkness starts filling out things and holds you back from doing normal things that you would want to do. We have done some research, a lot of research actually, that we know there is a relationship to like how your neurons, so the parts of your brain, are talking to each other. We know that it's different in people with depression than not depression. We also know that certain medications change how those neurons talk to each other, and then people feel better. We don't really know. I can't again, it's not if your number is 10, you're okay. If your number is 5, you're not okay. Like it doesn't really there's no blood test to know or things like that. Right. But we're getting there. We're ask me again in 30 years and we might have a completely different picture of depression. But we do also know that there's a huge genetic component. Is it completely all in your genes? Like, are you predestined based on your genes? Probably not. It probably also relates to how you were raised, how your parents talked to themselves, talked to you, how what adverse childhood events you went through or didn't go through. All of those things kind of work together to create the picture of your mood. And when that mood is dark and creeping in and you're dealing with all of these crazy things or like the dissonance that we talked about, then you'll start seeing these symptoms. So we list these symptoms out. The way you would get diagnosed with depression in a primary care or a psychologist's office is what we call the PHQ-9. So it's 9 questions that we ask you. Have you felt these on several days, most days, or all days over the last 2 weeks? Again, I felt it once or twice isn't on the thing because it's okay to have normal human emotions.
That makes me feel good.
Exactly.
I'm just sad sometimes.
Yes,
Yeah.
you are supposed to feel sad. Like, you are a human. But it's when it starts impacting the rest of your life. So, like we said, little interest or pleasure in doing things. The things you used to find joy in, you just don't anymore. You're not wanting to watch the TV shows you've always loved, or cooking the food that you always loved to cook, or hanging out with that group of friends. Feeling down, depressed, so that's number 1. Number 2, feeling down, depressed, or hopeless. I think we've all know that.
Yeah, that makes sense.
That just makes sense. And then we get to sleep issues. So this could be trouble falling, staying asleep, or sleeping too much. So I've heard people who are like, every 30 minutes I gotta lay down. This overwhelming thing comes over me. And then there's some people who are just like, I think I've slept 10 minutes in the last 3 days. Like, because you sit in bed and you're just thinking and you're worrying and all, like, your brain can't shut down and go to sleep.
I've been there. Like, thinking back, when I worked from home during COVID, when I definitely was depressed, I remember just taking a break often and just walking 20 steps and just laying in bed, and oftentimes falling asleep for 30 minutes, and having my phone so I could touch Teams and make myself green here and there. Yep. So that checks out.
Feeling tired or having little energy. So, maybe you can still get up and get out and get to the group event, but you're not participating in it as much. You're not talking to those people. You're not engaging as much, just because you want to go home and go to bed. Poor appetite or overeating. It goes both directions. So personally for me, I have such a decreased interest in food. Like, that's how I know that I am not in a good headspace, is when I just don't want to eat. Or I'm really excited about who I'm talking to, or like what I'm doing, or whatever it is. Sometimes I go there too and I forget to eat. But absolutely, food not tasting right, or not having just that interest in it. And then it goes the other way too, overeating, that emotional eating, where you just always are grabbing things and putting it in your mouth, whether it's, lots of this is sweetness related, but also it's savory, it's fried, it's all of those things. So it can go either direction, which unfortunately both not eating and overeating has major health consequences. And then we get to number 6, feeling bad about yourself, that you're a failure, you've let people down. I kind of label this as guilt. That's, in my head, differentiates kind of sad, that overwhelming grief. Because when you lose someone or something, a lot of times you get this overwhelming grief where you don't want to get out of bed and you don't want to do these things, but you don't feel bad about yourself. It's because you lost someone, or you're going through this hard time. When it switches into depression is when you start feeling like shit. And you're telling yourself that you've let people down, or you've let yourself down, or and then this is also where that intrusive thoughts come in. So intrusive thoughts is something that I see so many people deal with, and I've dealt with myself completely, of that, well, I suck. I couldn't get out of bed, I suck. I failed that test. Not even actionable items, more like I have no interest in doing the dishes. Oh, that was a big one for me. I would leave dishes in the sink and I have no interest in doing them, and then I would tell myself that I'm a piece of crap because I have no interest in doing the dishes. Why can't I maintain a home? No one's ever gonna I'm never gonna be able to share a home with anyone because
snowball
for sure. And then, so feeling bad about yourself or guilt. Number 7 was trouble concentrating on things. This is where kind of some of those focus things come into play. A lot of times with depression, we see tangible things falling off, whether it's your work starts getting impacted. A big thing when parents of, high schoolers or middle schoolers come in and they're like, my kid's all of a sudden failing. It's we talk about them about depression, because that's a huge, like, how things change. And you just can't focus. Your brain isn't putting 1 and then 2 and then 3. It's that like executive functioning is falling off the rails.
Yeah, well, it reminds me, like, my work definitely declined when I was going through it. Like, it was good enough to get by, but yeah, I mean, I think that's just like you hear about, well, yeah, somebody's not right or somebody's not performing. Could be in sports, could be in work, could be in anything. It's just not normal. It's like, well, maybe you should have a conversation with them and see, like,
how you doing.
It's the classic, hey, how's home life going? I think we get so, it's easy to throw a label on, oh, that person's an asshole, or that person's, just not good anymore. And I think about that sometimes too in sports, like people that go through slumps or just like are good and then just not good. Yeah. I was thinking about Breece Hall. I was thinking about Breece Hall. Yeah, the yips, but Breece Hall on the Jets today.
Just thinking about him.
I was thinking about it because he was the only Jet that didn't get. There's like 3 good Jets players, and 2 of them got re-signed to massive contracts this past week, and he did not. And he's my favorite player. I have a jersey of him, so obviously he's gonna get traded or released or something. But he had a really good first 2 years, and then last year he was like awful. And I was just thinking about, oh, I wonder how he's doing. Like I wonder what else is going on in that dude's life. But anyways, this is awesome.
Yeah.
Keep going through. Where did we leave off? Number 7.
So trouble concentrating on things, that like executive functioning, that why is my brain not working? Which again circles back to number 6 if you think about it, the like guilt. Because your brain, you're not doing as well in school because your brain is not working because your brain is sick, which means you're mad at yourself for not doing as well, which means and it just snowballs. Number 8 is one thing that like I don't see as much. People always ask me like, what does that even mean? Moving or speaking so slowly that other people have noticed, or the opposite, being so fidgety, restless that you're moving around more than usual. I find a lot of that's just kind of our nature. You're either someone who's slower or faster, but it can change. This can impact things.
I feel like that ties in, like moving slower makes sense for me more of just like, yeah, you're lethargic because you don't want to do anything. Nothing matters. You're hopeless. So I've at least that one, it kind of makes sense. I don't know about speaking slower, but like, I guess my tone of just monotone and soft and like so I don't care.
Eeyore picture kind of.
100%. Absolutely.
Like, no,
absolutely.
And then versus the other one of like being so the anxious person. We all know that anxious person who just like relax. Number 9, thoughts that you would better is last question. Thoughts that you would be better off dead or hurting yourself. So this is suicide ideation. Did want to note out there's a difference between passive suicide ideation and active suicide ideation. So passive is what I consider like fleeting thoughts. The like, man, it would suck if I'm not here. Or like, no, maybe I shouldn't be here. That's weird. Why would I think that? And then you move on, which is a phase of depression or having those thoughts. And then as those progress, your brain feels more comfortable with having those thoughts. And then it becomes, I'm not here. I could just pick up that knife over there. Or I could just pick up that gun. Which is still not, I'm going to pick up the gun. And I do want to say, data shows that if you talk about it, you address it, there is no increased risk of somebody committing suicide, the act. Should have put trigger warning in front of all of this.
No, wait, say that again. So yes. There's no...
So as a clinician, I don't want to be like, ooh, I think this person's having these thoughts. I'm not going to say anything because I don't want to give them the idea that there is no data that supports that. So
we should talk about it.
We should talk about it. We should, if you are, have a friend, have a loved one who you're like, oh, I think they're kind of feeling this vibe, please ask them. Or if you don't feel comfortable, encourage them to talk to someone else. But having those thoughts or having a communication of, have you had those thoughts? do you have a plan, or what would your plan be, and do you have access to that plan? Are kind of the three different stages that our brains go through. Nobody, because you brought it up, nobody says, oh, that is a good idea, I should go commit the act. That's not how it works. So please ask people, ask friends, be open, be honest. And then it's not a scary, like, those are legit scary thoughts, but that doesn't mean we can't be there to help.
Quick interruption. If you're enjoying this episode, I would love if you shared it with someone else. Honestly, that's the only real way that I want Quarter Life Clarity to grow, is word of mouth. It's people helping people. It's you saying, this is really helping me, and I've found it valuable, and I think it's worthy of sharing it with someone else that I love, in hopes of it having the same effect on them, of it helping them. Because that's really what this is all about. It's how can we all link arms and band together and get this clarity, collectively. It's not about one person, it's about all of us. And so if that's you, if you're listening, if maybe by the end of this episode you're like, yeah, this really hit home with me, and I want to share it with someone, like, I just ask that you do take a second to actually do that. And at the same time, if you haven't had that effect, if you don't think it's worthy of sharing with someone, then don't do it. But seriously, appreciate you being here. Appreciate you supporting Quarter Life Clarity, taking the time to listen, and enjoy the rest of the episode. I feel like I've definitely, like, just thinking back, I've thought about, like that. So you said there were two types of, what did you call it? Two types of
suicide ideation.
Yes.
Active and passive.
The passive one is like, I could do that, but I'm not gonna. I think I definitely thought about that, of like, sometimes just like driving down the road, it's like, I could drive myself off the road right now. You think about that and it's like, whoa, like, it scares me. I'm not gonna do it, but you realize, like, you could. And it's, I don't know, like, I think when I was really going through it, thought, it's so cool that you just threw a label, like a title to this thing, because I thought about, like, I could, but like, I'm not gonna, it's, and that's cool that there is a difference.
There's a difference in the pathology, which is our fancy word for the badness, the sickness. Is like a mild sickness versus a more severe sickness is where it gets to that active thoughts and plans. And another question I had, thank you for just going through all that. That was awesome. Do these symptoms, do they have to, because you talk it, I thought of this when you were talking about grief, because with grief, when we lose something, when we go through something, there's an event that triggers it. Does there always need to be an event? No, there does not. Depression comes in so many shapes and forms and symptoms. And like, these 9 things are what we put together at some point for this illness pattern and labeled it. But there are so many other symptoms that might be related to your depression. And in the same manner, there are so many things that kick it off. There are so many that we'll never know for sure. And even in one human being, like, there might be an event that kind of started it, but I feel like it's more of the unmasking. An event might unmask it. Like, you started to feel depressed for maybe a big it's like cognitive dissonance. It's how things change in your life. So you're like starting to develop some of these symptoms, and then you can't focus, and then you get laid off, and then it kind of triggers, like, it's that domino, like the domino hits the marble that falls off the table, type of a thing, to like unmask some of these things. But a lot of times they're already there. And then I think it's in a similar manner. There are human beings of the world that, and or God can train us to be a human being of the world that has such good rooted firm foundations in your identity and what your suffering is for, and kind of the healthy side of things, that when that event happens, the marble falls and bounces right back up and keeps going. So that's there's hope.
So in order, I think I know the answer for this, but in order for me to, if I filled out this questionnaire,
which there are tons of websites that you can just Google depression questionnaire, and it'll come up and it'll start asking you and it'll give you a number, and
awesome,
definitely all over the internet.
So where is there like a point where it's like, is it black and white? Like, oh, you answered these this way and you said this X amount of times for always, and that, like, where it's like, all right, you're depressed, you're not depressed. Like, what is that like?
So yes, when they did the research studies for this to validate this as a questionnaire, they labeled, and I want to say it's like 1 through 4 is like slightly depressed, 4 points, you get 1, 2, or 3 points based on how often you feel each symptom. I can't even tell you the numbers because they don't really matter. Like there's like if you've scored 16 points and above, you're severely depressed versus moderately depressed, or things like that. There are numbers that say like yes and no. But clinically, and how I use this as a tool when managing patients with depression, or how I feel like it fits in my body too, it's kind of hard because it is subjective. So I don't know. So it's kind of hard because it's subjective. Sometimes you have these symptoms for things outside of your mood. So poor appetite or overeating, you could have a hormone problem that's causing one of those things, or the lack of energy. You couldn't just flat out have insomnia. And so you don't sleep and have little energy and trouble concentrating on things because you have a sleep disorder, not because of depression. So I don't take the numbers as black and white as I do for other things that I treat and manage.
It's just like a starting point.
It's a starting point to have a conversation, to kind of do a good check-in of yourself, the like scan of like how am I feeling? Like, is this working? And then it helps me with treating and management too. So if I, handed you this piece of paper or this questionnaire and you scored maximum on all of them, and then 6 months later we come back and you scored minimum 0s to 1s, maybe 2s on all of them, then I know what we're doing is working. And then if you come back 6 months later and you're all in the maximums again, then I know how we're doing is not working. But I don't really sit there and like, well, today you were 14 and yesterday you were 15. So so it's the art of medicine. And again, have a primary care provider, have someone that you're open and honest, that you can talk to them about this and how you're feeling and kind of your symptoms.
Yeah, and one thing, just to go back a little bit, something that really jumped out to me, because like I said, sometimes day to day, even week to week, I go through dry seasons where it's just, I do feel more of that depression, or just dry days where my identity is probably a little bit too tied to like work. I didn't have a good day or a good week, and I feel that mood shift. But to me, the more than 2 weeks, these things have to last more than 2 weeks, is like, I don't know, gives me a little bit of like, you're okay. You're just, to your point earlier, you're just sad, kind of.
Yeah, it is okay to be sad.
Yeah.
The classification for major depressive disorder is 2 weeks. And that's when we'll really dive into therapies, whether it's working with a therapist or medication therapies, things like that. Is it lasting 2 weeks? And but humans of the world sometimes feel sad for 6 months, years, their entire life. But it's like, we think about it in 2 week chunks.
Right. And so also, kind of like what you said earlier, depression seems to show up differently for everyone. Like, it's not so black and white. You can't look at a number and be like, all right, dude, you're depressed. Like, let's get you on this. Or, so can you speak a little bit to kind of the warning signs, or just not even necessarily symptoms, but how it can show up differently for everyone?
So a couple of things that if I'm talking to someone and I'm learning about their life and why they do certain things or what they're doing, what their day-to-day looks like, red flags in my head that come up, especially, we see this more in women, but physical body symptoms is something that is not on the DSM-5, but it's definitely, and we have data to back this up, like it's definitely a huge part of how depression manifests in our bodies. Kind of like I said, the neurons, the parts of our brains that are communicating aren't really working. Your entire GI tract is lined with those neurons as well. So a lot of stomach issues, stomach pains come when we're depressed. Bloating, constipation, diarrhea, versus, but also, again, those might have other things that are wrong. So again, please talk to somebody. Pain, just pain in our body can start triggering and flaring when we're depressed. Headaches are a big one. I see headaches a lot in like younger people because they just don't really know as well how to describe their pain. So headaches, are a symptom that it's like makes me as the doctor try to be like, okay, is there a depression going on? Same side. So data actually shows that like women feel those more than men. I'm never going to be like, well, you're a man, so you can't have stomach pain with your depression. But, a woman who's talking to me about her stomach issues and her anxiety then encourages me to address her anxiety more as well as, her stomach issues. In men, a lot of times we see anger, aggression, outburst, risky behavior. Adam and I were listening to a podcast about gambling the other day and like how huge of a thing that's becoming these days, the sports gambling stuff, and it's all tied in with
addictive, anxiety, depression.
Correct. Yeah, absolutely. Or even substance use, because you're not finding that joy or that energy or the being as satisfied from your work as you thought you were. So you grab a beer because the world sucks, so why not drink? And then you just keep dragging.
Yeah, it's just like you're chasing highs. Like it's the gambling, it's the
dopamine.
Yeah, exactly. 100%.
Which dopamine is one of those neurotransmitters that's messed up in your brain that you're like trying to find so much. And so it all comes out into this mess. Yeah.
And something that came to mind is I've definitely dealt with stomach issues in the past of like thinking it was like IBS. I've never had any, and it was, I would say I wasn't depressed at the time. It was more anxious. And that definitely, is that a thing?
Yes.
Okay.
1,000%.
Well, that makes me feel a little bit better.
Yeah.
Because I think whenever I'm stressed or anxious, I feel it rise up a little bit more.
How many, like, have you been before? As a dancer, you get ready for that performance and you get like the anxious poops. Totally a thing.
Yes, 100%.
Right?
Yes.
We've all been there.
Yes. And also on that, can you touch on maybe the difference between, I guess, depression and anxiety?
Yes.
Like high level, maybe?
High level, video podcast, this is nice. I do this all the time, like when I'm trying to explain the two. They are sisters. It is nearly impossible in a clinical fashion to pull those two apart. There are human beings who deal so much more with the anxiety than the depression aspect. And there are human beings who deal so much more with the depression than the anxiety aspect. But I treat both of them the same way. There's some nuances in there, but a lot of it I treat very similarly. Being so depressed that you become anxious, I think that was something I felt in my depression. Once I got so the world suck, or like I suck, the world, there's no hope, everything's going to shit basically is when I was like, and I can't sit still and nothing is happening and
Despair. Yeah, you can't do anything about it.
exactly.
Yeah.
And my anxiety in my body shuts me down. Like, I become a couch potato. I couch rot when I'm anxious. And so that, which it goes with the depression too, because that's part of the depression as well.
Right.
And then I know people who have been so anxious, so worried about whatever it is, that they become depressed. But then I know people who are just anxious. And they have no depression. They have no hopelessness or guilt or despair or any of those things. They're just anxious and worried about everything in the world. And I know. And there's people who are are depressed. They feel guilt, their hopelessness, and they're like, "No, why would I worry about anything?"
Yeah.
So it's a spectrum. Doesn't really make sense. It's the human experience.
Yeah. No, right. And I think it's interesting too, like that they are sisters. I would never think that because they give you, I don't know, to me they're so different, having kind of experienced both in a sense.
Yeah.
And on that too, I feel like in terms of just what I've seen, which probably isn't a ton, I feel like kids, especially these days, are getting overdiagnosed with, name it, everything.
Mm-hmm.
And do you think, whether kids, the quarter lifer, whoever, do you think we do too much of that? Because I also think about, well, depression, you know, are you depressed or are you just like, to be frank, like being soft in a way? And I think there is a difference, but it's some of that. Are we being, to hit on depression a little bit more, I think, than anxiety, are we just being emotionally not resilient? And or are we overdiagnosing? I don't even know if there's a question there, but can you speak on that a little bit?
So I remember when my cell phone didn't have access to the internet until I was in college. Like, I'm a little bit, I think there's this huge change of mindset, and I'm not the expert in generational whatever. But now we have access to so much information, and kids have access to so much information, and it takes your TikTok algorithm like 7 seconds to realize that you wanted to watch a video to learn about insert whatever here, and then it's all you learn about and it's all you think about. So I think there's a lot of what's happening in the younger generation, with they just have so much more access to information. So they are identifying that like depression is a thing, younger and younger, which, hey, coming from our parents, where I'm having to tell 60, 70-year-olds that like they're depressed and they've been this way for 30 years and they've never even thought about it, kind of okay with it. As long as we don't fall into the trap of, I'm depressed, I don't have to do anything because this is my medical illness. No, because it is manageable. There are tons of therapies we know help, and there are tons of tons of therapies, tons of medications, things like that. Let's start the process. Let's figure out what it is and why, and make you better, instead of just like sitting in it. Because there's plenty of humans that we're never going to make it go away. We're just going to manage the symptoms. But there is also certain people with depression who we do make it go away, and they get off medications, and it's a wonderful thing. So it's just, we have so much more access to the information to learn about it. So you can't comment on if they're soft or not.
Yeah. No, that makes sense. And it kind of but makes me think about like when I was really going through it, I did not tell anybody because I was like, one, I didn't know if I was depressed, but I also didn't really want other people to know, like I was living with my dad. He knew I was sad, but I think there's a shame about it that at least I've felt, especially for me being, I don't know, growing up, just my whole life up to that point was I was this kid that never did anything wrong, always got good grades, was always good at sports, was social. Like I never really had any, I don't know, downfalls, at least like publicly. And then it was like, well, no, like this dude is depressed. And I think especially men probably deal with that more. Maybe that's just me speculating because it's some of that culture of like there's a Bill Burr skit that my dad actually loves where it's just like he's just like you push it down and you just don't talk about it. And like that's to go about like generationally, that's how maybe kind of our parents or people in their just 60s, 70s, just the older generation, that's what they grew up with. Mm-hmm. And now I feel like we're kind of doing the opposite on the other side of the spectrum. And there's probably some middle ground. But my point, is there anything that you can speak to on the shame level of depression?
Yeah. It's definitely there. You know, we don't think about can you name a single depressed character on pop culture? Like when you think about psych illnesses, you think about like One Flew Over the Cuckoo's Nest or like people in mental institutions or things like that, which is just not the world we live in. And it's not truth. So if you've never like seen someone or worked through that with someone or had someone open and honest with you about how they're feeling or that they have these dark thoughts, it's super isolating. And then also that's the illness is that you think you are not worth talking to other people about how you're feeling. You think you are not worth anyone giving you 2 cents of the day, or I don't care about myself, why would someone else care about how I'm feeling? Which is just, it's that illness speaking, it's depression talking to you, it's that intrusive wrongness, intrusive thoughts that are just in there chipping away at you. So why would you talk to someone else about it? Because there's nothing in the depressive state of mind that wants to talk to other people. Not about the good stuff, and definitely not about the bad stuff.
Yeah, and it kind of falls in line with just the whole idea of quarter life clarity in a way of like, let's start talking about these things because we're all going through it and it's hard. And so I think depression falls under that same, like whether you're depressed or not, it's the same thing of, well, let's talk about it because you're definitely not the only one, right? I think everyone that's gone through their 20s, most people have at least gone through a season where you're at least sad, like you're going through something, it's hard. And so I think also just like having that support system is definitely important, and realizing it's okay to talk about it, especially like you got to find the right people to talk about it. And all that stuff is a factor in all this. But yeah, I know for a fact that when I was really going through it, it's like, there's no way I'm talking to anyone about this. So just to read a stat quick on this, in 2020, 17% of 18 to 25-year-olds had a major depressive episode, but more than half went untreated in prior years. Cost, stigma, time constraints, and privacy concerns were the main barriers. So obviously that was in 2020, a few years ago, but I mean, I definitely fall under that. And so kind of moving on to treating this, like how can we kind of move on from it? What are some proven ways that we can, or that we do, treat depression?
Yeah. I always call it a 1-2 punch. So punch number 1 is lifestyle modification. Changing, like we talked about, so much of depression is that cognitive dissonance, it's that guilt, it's that hopelessness, it's being at the bottom of the snowball, getting yourself all the way down. So it just takes work coming back up. Big things, going outside, like getting outside. There is a reason seasonal depression is a thing when people can't go outside. Just being outside, being in that sunlight, being in nature. Exercise. The recommendation that the American Heart Association and all of the other medical professionals have agreed is 150 minutes per week. The data shows not only is that great for your heart, for your immune system, but it's also really good for your mental health, of just moving your body. I don't know if you feel this, but in my, I have a degree in dancing, so I know exactly how to work out and what cross-training actions I should be doing in order to, and so it makes it really hard to overcome that perfectionism of I know exactly what I should be doing, and that doesn't matter. I just need to do something.
Even just going for a walk. I've started going it's funny, I used to think walks were the dumbest thing ever. A couple of years, I think it might have been a year ago. It was pretty recent. And one day I had done legs the day before and I was so sore and I was I got to get outside. I was going to go for a run. I was I literally can't. No. So I went for a walk and I was not looking forward to it. And then I did it. I didn't bring my phone. And it was the best thing absolutely ever. I could actually think. It was a nice time to unplug. More than it wasn't really exercise at that point.
It was.
But it was. Exactly. Yeah. And now I start my day most days with a nice walk. And yeah, I think the 150 minutes per week, that's a little more than 20 minutes a day too. It's not that much.
Exactly. And it does not have to be all, you don't have to do it every single day. 2 75-minute sessions in the week has the same exact data as 3 or 5 30-minute sessions. Yoga, mindfulness-based exercises, journaling, socializing, being with friends, getting out and doing things. I used to call it for myself what makes Annie. Childhood Annie was always very happy and joyful, and it was her smile that changed everything, is what people told me my whole life. So then I hit a point to where I was where's my smile? How do I be Annie? And I dug into those things, and that's kind of what I found that really helped. Whether it was calling my sister and just hearing, chatting with her, or making something. I'm a huge craft deep person, so let's pull out the sewing machine. Those kind of things.
Yeah, on that, kind of what you said before, going out and doing stuff with people. There's been times, I think more recently, and I wouldn't say I'm depressed recently, but those drier seasons where it's I'm sad, I'm frustrated with work or whatever, and I have something a family event or something that I have to go to, and it's breaking up my day. I'm pissed I gotta kind of do it. I should be working, and then I do it, and then I go to back to work after, and it's you just kind of get reset. Yeah, it's I'm pissed going into it, but then I come out of it being well, I actually probably really needed that, and I should be a little bit more mindful about doing those things a little bit more.
I know our church leads so much into spending time with God and your quiet time and those kind of things, which absolutely asking that spirit to come in and kind of help clear your mind, even if you don't know that your mind needs clearing, relying on this Holy Spirit to come in and help clean your mind is such a huge part, and just connecting back to God, creating those routines, and a huge part for me in all of this was routines. Lifestyle modification and therapy go very well in hand. Some people can, especially when we're just kind of doing that tune-up, you can start your own lifestyle modifications yourself. There are times, and I had this when I was in medical school, where you just feel so low and crappy, you're never going to be able to pull yourself up by the bootstraps and get out and do it yourself. That's just not how your brain is working right now. It is sick. It's not just you can't just snap your fingers and go on a walk and the whole world gets better. You're going to have to put in more work. So cognitive behavioral therapy is kind of the training that a therapist goes through in order to help you change or help you make those lifestyle modifications. The kind of thought, and I copied this from Google because it really helps. So cognitive behavioral therapy uses targeted strategies to help patients adopt more adaptive patterns of thinking and behaving, which leads to positive changes in emotion and decreased functional impairment. So it was described to me as kind of like a ladder, or like a 3-pronged ladder, where your behaviors impact your emotions, which impacts your thoughts, which impact your behaviors, which impact your emotions, which impact your thoughts, over and over again. So working our way down, you feel like crap, you don't have energy, you don't get up and do anything, you feel like crap some more. Same thing working its way back up the cycle. So you have to start changing your behaviors in order to start changing your emotions, to start changing your thoughts. So even as small as like, I brushed my teeth today. And so that can change how your teeth feel. And so you actually feel kind of good about yourself. And that'll inspire you to maybe take a shower, which will work your way back up. And it's a process. It takes time. You cannot snap your fingers and it all magically gets better. And it's really helpful to do this with a therapist or a person who understands the process.
Does that work backwards at all? Like, because I've always thought kind of the opposite, not always the opposite, but can it be thought, emotion, behavior?
Yes, they go in.
Okay. It's a cycle that if you change one, it'll affect the others too.
Correct. So, the Holy Spirit comes in and changes our thoughts, which changes our emotions, which changes our behaviors. That's like how, why we get baptized or whatever it is, because all of that is happening. That's how our brains are designed to work. And so it can work in this really crappy way that we have to like focus on this really crappy time. So strategies include identifying challenging, problematic thoughts and beliefs, scheduling pleasant activities to increase environmental reinforcement, and extended exposure to unpleasant thoughts, situations, or physiologic sensations to decrease avoidance and arousal associated with the anxiety eliciting stimuli. So basically what that means,
please.
So exactly, translated for the common man, not even. So working with a therapist, identify, my therapist and I, when I was in medical school, we would sit down, and like draw out plans for the day. That was something that I was having a really hard time doing. I spent so much time in undergrad in rehearsal, my days were scheduled out. So it's like I had an hour to study for that exam the next day. Like that was it, and that was all I got, and I had to study at that time because that was the only time I had in the day. I got to medical school and all I was doing was medicine, and it was a very open, flexible, you fill in the time however you want kind of a thing. And I wasn't doing anything because I didn't want to. So we sat down with calendars and, schedules of the day and drew out my day a little bit because I needed that routine to have scheduling pleasant activities. I needed that routine to schedule a pleasant activity in my day so that I could have a positive thought so that I would feel better about myself. I would schedule in my like Annie events. I would, and so it just kind of helps you cycle back up and feel better.
What is I don't know if I'm reading this right, an extended exposure to unpleasant thoughts, situations, or is that saying you should
starting at the end, like those anxiety eliciting stimuli. So if you always get anxious when you have to go talk to your boss, and talking to your boss is a huge part of your job that you do, so you are constantly having to do that, and you are getting anxious every time, so you start shutting down when with that normal like task that you have to do. Through CBT, through therapy, through all of these things, you're working with like, why are you anxious about that? Why are you having that reaction to this very normal, they're another human, like it's not that hard. Why are you having that? Which sometimes takes diving into, you know, so you look like your dad who yelled at you all the time. Or like whatever it is, like kind of diving back into your childhood, why you're having that response to a certain stimulus, and why is that happening, and then reframing your thoughts moving forward. So
that makes sense, because I read that as like, wait, I should be putting myself in a situation where I have unpleasant thoughts situations. And that makes sense when you're not, you're kind of doing it, but you're talking about why is it unpleasant and like unpacking that, right?
Okay. It's a huge part of it, because all of those thoughts of how your coach coached you, how your parent, like all of those things impact your emotions and your thoughts. So you got to unpack it. Take some time.
Yeah. And so, to go back to your story a little bit, and you working through this yourself, you dealt with it with that post-college era, and those solutions worked for you then. Is it different having dealt with it maybe later on? Like, does that solution evolve over time?
Yeah, absolutely. It completely does. It's kind of funny how I've gone through like this big time in medical school, and then you're feeling better, and then you have this other hard stress, which for me was residency. Residency is not easy. Adam and I moved to Connecticut, like moved halfway across the country. We're far away from all of our family, and working 80-hour weeks. And so I started noticing something slipping, started seeing some of those red flags and because I knew how much eating was an impact for me, I stopped eating, or like was eating less and couldn't gain weight. You don't have time to work out, so you don't have that much of a ability to adjust that. That's not true. There is time to work out, but I didn't. So I started noticing some of those flags start to come up, and so I found a therapist and started working with her. Worked really well, had to find someone who was going to work with my timing, which is a huge part of it. But so instead of letting myself get to a point to where I like wasn't doing the dishes or wasn't showering or because I didn't have time for that. I had to go be a doctor. I said, I'm going to make time for therapy. And we started working through some of those foundational things before they became an issue. So like in that phase of my life, I was working about like perfectionism, because that's such a huge thing of being a dancer, thing of being an academic person, that you like want to like make good grades and everything, and all of a sudden you're in this real life world and it's not as black and white as that's the right answer or the wrong answer. So how do you deal with that? I was also doing a lot of like comparison is the thief of joy. And so working with a therapist through those kind of things before they became an issue was a huge help for me. And then we also, because we looked around and we said we have no community up here, we said, hey, look, there's a church around the corner. And so we kind of were able to eventually dive into that church, dive into that community. So because a church community is so designed, when you're with like real good Christ following people, to provide you that emotional support, to help point out the behaviors that aren't aligning with a Jesus-like world, so that you can change your thoughts and emotions and change your behaviors and make yourself better over and over again, and become more like Jesus.
It all makes sense.
Yeah, it's crazy.
Yeah, and a couple thoughts. I mean, to your point about going through it and then warning signs start to come up and what do I do? I've definitely felt that. I've only had that one season that I was like definitely depressed, but yeah, like I've said multiple times, those dry seasons, those tougher times have certainly came up, and just in going through that more, you do, just like anything, you get the reps in dealing with it. So when things start to be off, like a big thing for me is I actually change my routine. Sometimes it's like, sometimes especially doing what I'm doing, the routine can get stale. And so sometimes I will just like make it chaos in a way. Like I'll change what time I go to the gym. I'll work late. And it's just, I think my point is that just the more you go through those tough times, the more you've experienced it, and you can stop it before it gets bad. That's what you're saying. And so that's one thing, but also, yeah, I mean, in terms of solutions, like what worked to get, what works to treat depression. I mean, I've talked about this in episode 1, but God was my treatment for depression. I mean, obviously there's other things too, like getting outside was a big one for me, but God was like how I got over my depression. You think about why. Well, my belief system was a mess. And so I latched on to a belief system that I believe, like we believe, is rooted and is not going anywhere and is a rock. And so that, like, you think about why really that I clung onto it so hard, because I need truth, I need direction, I need who am I, where am I going, what is life about, purpose, all this stuff that I was questioning and going through that led to despair and depression and all this stuff. It was like, I need something that's legit and that makes sense. And God woke me up in that way to really seek him out, and it was the best decision I've ever made, obviously. But yeah, I mean, I think a lot of this stuff, to me, it goes back to who are you. And I don't want to say like what works for you. I think there's both. It's like what works for everyone, but then there's specific things that kind of work for the individual.
And I think part of what we work through in our 20s, when we're like going through these things and figuring out like, are the values, what's important to you. Like you've talked about beliefs, which I feel like beliefs and values go hand in hand, but they're not the same exact thing. But like, do you value your career more, or you value this or that? Like there's so many of that you're having to like work through, and by going and losing some of that in depressive states, you can find that this is what is valuable to you, and these are the things you're gonna fight for.
Yeah, 100%. And so one thing I do want to ask too, because we've talked about a lot, how do I get a primary care doctor and or therapist? Because I know I would only have a primary care person if my parents told me, hey, do this, do that, XYZ. For the people that don't have that, I have no clue. I would have no clue what to do besides maybe pick up the phone and call somebody.
Totally. Which I would also say, hi, welcome to your quarter life crisis. You are becoming an adult. That is what this process is. Congratulations, you're becoming an adult. Now we have to start like doing some things that adults do. One of those is get a primary care doctor. So what do? First step is always insurance. Unfortunately, in America, you either have insurance or you don't. We're supposed to have health insurance. So figure out what you have. Like, do you have health insurance? Figure out what your provider is, where you like identify where your insurance card is. Trust me, I work in insurance every single day and I do not fully understand it. So you are not weird if you do not understand health insurance. Like, it makes no sense. It's going to change 50,000 times before you actually use most of it. But find your insurance card. A lot of times there's a website associated with it. Go to your website, make an account. It'll have you type in your insurance numbers from the card and you'll make an account. you're a millennial
Yeah,
Gen Z. You can make an account on a thing. A lot of times on there's a button that says find a provider. Start there. So primary care, find a provider. They'll be located in your there's maps that'll tell you where they are. They have certain buttons where you can go online and schedule an appointment with them, all at 2 a.m. whatever time you want to do it, versus calling, finding them. I will say, take time to look at that human being and decide if you would get along with them. You don't have to be their best friend, but there are many different types of providers. We in the provider world talk all the time about paternalistic. Are you going to be the doctor who just walks in and is like, you need to do X and Y and Z, bye? Or are you going to be the doctor who walks in and is like, yeah, kumbaya, let's all really talk and vibe together, which I'm kind of that kind of person. So there are me's and there are non-me's. So look into that, see if you get a good vibe from them. And it is okay if you go and you say, I did not like that vibe, and you never go back. I am not offended if you do that. I want you to have a doctor who understands you, who you feel comfortable communicating and opening up about these dark things or your stomach pains or all of I need to know. I need to know how you're feeling. So if you don't feel comfortable talking to me, don't come see me. That's okay. But that's where to start is figure out your health insurance, go to that website, find a provider. Similar things for therapy, for therapists. Actually, a lot of health insurances are now recognizing how important it is to loop in mental health care into your health insurance. So we'll sponsor, and I will sponsor therapists or connect to certain websites. The websites that you hear about on your podcast ads or whatever it is of BetterHelp and Spring Health and all of those things, those therapists are good. They're doing the right things. There's nothing that can't be done online that in person, especially for our generation. I get some of the older people are I can't figure out technology. We're not them. So start on that insurance website, see if there's a button about mental health or therapy even, or those kind of things. And a lot of times it'll take you to a list of providers and scheduling virtual health type of a thing. Similar phrase of the biggest thing that impacts your outcome of your therapist is your relationship with them. It does not matter how many times you see them. It does not matter how in person or virtual or all of these things. It's, do you and that person connect? Also, it is okay to go and be like, we did not vibe, I'm not going back. Nobody takes offense to that.
No, it's really good to know. And so is therapy covered under insurance? That's something you probably have to scope out.
Yeah, it depends on your specific plan. Sometimes it is, and sometimes it is only if you go through ones that your insurance sponsors. There are plenty of therapists. If you see the initials LCSW, it's a licensed clinical social worker who's typically certified in therapy. So that's kind of the initials you're looking for, and there's tons of those all around that have in-person things that you can also find, and they can also bill your insurance, or they don't bill your insurance. There's a lot of different nuances to it. But
okay.
Most of the time it is.
Yeah. No, thank you for just going through all this. I've definitely learned a lot in terms of just this whole concept. That's the whole point of this thing. I kind of wish I had it a few years ago, or at least learned about it.
Yeah.
But yeah, I think just to kind of close, I think a lot of this depression, it's tied to identity, which we talked about that a couple weeks ago. It's hard, like what we said before, it's hard to sometimes be 24, 28, 32. There's a lot going on. There's a lot of pressure. There's a lot of I got to figure this out and by this time and comparison and all this shit we're dealing with, that people just do end up being depressed. And whether something happened that maybe caused you or pushed you that way, like something that happened to me, or it's just you just over time, it's just what's the point? All this stuff, like we've talked about, it comes in a lot of different ways, but I think, something that I would say is just, I do think everyone goes through this in some way. Not everyone talks about it, kind of like me until now. But it's just kind of getting rid of the stigma around, like, I'm not supposed to be depressed, like this something is wrong with me. Like, there's actually real tangible things in terms of identifying it, like you took us through today, Annie, and also some real solutions in terms of overcoming this. Because I think anyone who's actually depressed or just sad, it's like, I don't want to be sad forever. No. And I think that's something too that's important, is sometimes it feels that way. I've been there. It feels like, when is this ever gonna end? Like, I just don't, like, I'm waking up every day, just one day at a time mentality. But man, it's kind of been a lot of those days. And I think on that, oftentimes when you're in it, when you're going through it, it's hard to appreciate the progress that you are making, and understanding that those are just wins, and you stack up enough of those days putting one foot in front of the other. It does suck and it feels like you're still being stagnant, but I think oftentimes you're not. And personally speaking, I know when I dove into my faith, when I started to just wake up to who God is, but also just who I am, and trying different things, and almost just having like a fuck it mindset of just like, I gotta kind of figure this out, and nothing else matters, and I gotta figure out who I am and all that stuff. And so, it comes in a lot of different ways, but there are solutions. You're not the only one. And that's, I think it's so important for people our age going through this right now.
They call it a come to Jesus moment, because it's hitting the rock bottom, and it's because it works when you come to Jesus. It works. Like, he wants to know you, and he wants to hear your crap and how shitty you feel, even if you don't want to tell anyone else. Like, he cares about you, and he wants to know you, and he died for that crap. Like, that's...
Yeah, we'll wash your feet. Yeah, even as we're sinners. Yeah, 100%. Any other, like, closing thoughts from you in terms of, if you could say something to that person, that quarter lifer who is maybe going through it, maybe going through something similar, maybe what you felt, or, I mean, you have these conversations, I'm sure, plenty, but any message to them?
Yeah, I'd say pay attention to your emotions. I highly encourage just check-ins with yourself, even if you're feeling good, even if you're feeling crappy. Do that, like, body scan of, like, is anything wrong? What am I feeling right now? Don't, there is an attribute of this life that is just kind of, you just gotta keep pushing. You just gotta keep going. Like, the day's just gonna keep going. But don't be afraid to, like, step back, step out of the grind, and do the scan, to figure out, how are you feeling? Are any of these symptoms something that you are dealing with or addressing, or, like, are they creating crappy relationships in your life, or is it impacting, are your emotions impacting your actions? And then and be real with yourself.
Yeah, I think that's super important. You got to be honest.
And then be real with other people. It's so, having that intentional, open relationship is hard. It is not easy. We are not, society has not built us that way. God built us that way. Like, he designed us to have real open community. But the society that we live in tells us to, like, put on a mask and a facade, and everything is life, happy, cheery, bubbly, rainbows and kittens. It's not.
Yeah.
We all know that. Or, like, it's the sooner you come to that realization that everyone's kind of going through crap, it's a little bit better.
Yeah, your perspective on sadness, depression does change. Of like, yeah, it's just what you compare yourself to is really what it comes down to. When you're comparing yourself to all these people that you think have it figured out and are great when they're really not, we compare what we see and we don't see them behind closed doors, just like you are when you're going through it, when you're having that tough day. And I think that's something that's been a game changer for me, to just realize like we're all the same. We're all the same, but it doesn't look that way. But especially when we're by ourselves, we all have those tough times. And again, the root of quarter life clarity is really that. Just let's talk about it. Let's not hide in the shadows, because that's where shame really digs in. And when we can actually bring these things to the light, you feel better about yourself just by knowing that other people are going through it too. That's it.
Yes, I agree. Like that community is so important, that like we are called to serve each other in grace and truth and love. Grace and truth and love. Like that's, we can talk about the medications, we can talk about the therapy, we can talk about all of these things, but at the end of the day, that's what our souls are all craving, is that grace and that truth and that love from God through our believers. So there's so much hope even when things feel hopeless.
Hey guys, I just wanted to say, so sometimes those lifestyle modifications, that working with a therapist for those cognitive behavioral changes, it's just too hard. And that's when there's a great place for medications. We have so many great medicines, kind of like how we talked about earlier in depression, the way our brain is talking to itself, the chemicals are messed up. These medicines change those chemicals. So it allows our brain to get back to more of a normal communication pattern in itself, so that we can make those changes. They take time. It's not like Tylenol where you can take it and automatically feel better. They take some time to make these changes. We typically say it's about 4 to 6 weeks. Personally, when I was really, really low, I started one of the medications. And I will never forget, about 2 weeks in, I woke up one Saturday or something to go to the grocery store. And I just went to the grocery store, and I didn't have that voice in my head telling me that oh, this and this and this is what you're going to do wrong. And you're terrible for all these. That intrusive thought that I couldn't get out was suddenly just gone. My brain was silent, and I could actually have room to breathe and, create that space to make some changes. They're not without side effects, but we have so many different ones that if you are experiencing a side effect, please talk to your doctor, whoever's prescribing it, so that we can help adjust and adapt and change. But it's definitely an option. It's definitely something to think about, and not a crutch at all. So please, if you find yourself in that situation, or someone, so it's an option.